In this video, I'll be talking about the concepts of obstruction to the superior vena cava, right? And I'll be talking about the intercostal nerve and the surface landmarks of lungs. So let me read first. Let us understand concept of first thing. The first thing written in our notes is internal thoracic veins are tributaries of brachiocephalic vein. In the second point written is obstruction to superior vena cava above the opening of azygos vein. What happens? So let us go with the first point. The first point, and you have to understand what is the same thing what we discussed in the last video regarding the drainage. The same thing I drew, but understand that this is what you have got an internal jugular vein, right, subclavian vein. They fuse and form brachiocephalic vein, and brachiocephalic vein that drains into superior vena cava. This is on the right side. You can see same thing on the left side, right? The first point written here is internal thoracic vein. This is the internal thoracic vein. Internal thoracic veins are tributaries of brachiocephalic vein. You can see this. This is a brachiocephalic vein, right? This is an internal thoracic vein. Internal thoracic vein drains into the brachiocephalic vein. So that is the reason it is known as internal thoracic vein are tributaries of brachiocephalic vein. And the next thing you have to understand here is we are going to deal with the concepts here. The first concept is you should know the basic concept. The basic concept is this brachiocephalic drains into the superior vena cava. Superior vena cava opens into the right atrium. Right? The deoxygenated blood goes into the right atrium. But suppose in first scenario or the second scenario, if you got an obstruction, either this is azygos vein which drains into this superior vena cava, right? So understand the concepts that we already spoke about this, right? Hope you remember. So let us see that what happens if there is an obstruction below the azygos vein. What happens if there is obstruction above the azygos vein? Suppose if there is obstruction below the azygos vein, you might be thinking there is a block of the road, so the blood cannot drain into superior vena cava. If there is an obstruction above this azygos vein, yet you might be thinking there is a block, it won't go into the heart. But God has given some system, collaterals, right? So let us discuss now what are the bypasses, right? Mechanism ultimately it drains into the heart. If one road is blocked, let's go with the other road. So let us understand the first thing. The first thing written in our notes is obstruction to superior vena cava above the azygos vein. So what's written here is internal thoracic vein, right, goes into superior. The first one is superior epigastric vein, inferior epigastric vein, external iliac vein, common iliac vein, right, inferior vena cava, and the right atrium. So let us see what is it trying to tell us. If you look at this aspect, now we are dealing with the obstruction above the opening of azygos vein. This is azygos vein, where the blood from the thoracic intercostal veins they are at last drained into the azygos vein, from there superior vena cava. If there is obstruction above the opening of azygos vein, let's see this route is blocked. So how ultimately the deoxygenated blood goes into the heart, let's see. So this blocked, right now the blood, once this is blocked, the blood from this aspect, it can be a inferior internal jugular vein, a subclavian vein. Now since this route is blocked, it goes into the other way, and the first way you have to understand here is you can see this internal thoracic vein. The blood goes into the internal thoracic vein first. From the internal thoracic vein, it goes into this superior epigastric vein. So this is a superior epigastric vein, right? This is an internal thoracic vein. That internal thoracic vein, you know that the superior epigastric vein and this musculophrenic vein, they form the internal thoracic. But right now we just understand the internal thoracic vein goes into the superior epigastric vein. This is a superior epigastric vein. From the superior epigastric vein, the blood goes into the inferior epigastric vein. From the inferior epigastric vein, the blood drains into the external iliac vein. This is the external iliac vein. From the external iliac vein, it goes into the common iliac vein. From the common iliac vein, it goes into the inferior vena cava. From the inferior vena cava, it goes into the heart. So yet, if this road is blocked, so it can go through this internal thoracic vein, superior epigastric vein, inferior epigastric vein, external iliac vein, common iliac vein, right, internal vena cava, inferior vena cava, then to the right atrium. This is the one mechanism. What happens if there is a block above the azygos vein? Let us see the other mechanism. The other mechanism written here is, first it goes in internal thoracic vein, from there anterior intercostal vein, then the posterior intercostal vein, azygos vein, superior vena cava and the right atrium. So let us understand the second mechanism, how it goes into the blood. So you can see right now, this is the point where it is blocked. Right, the blocked blood goes into this internal thoracic vein. From the internal thoracic vein, it goes into this, you got an anterior inferior vein, anterior intercostal veins. Then it goes to the posterior intercostal vein. So I wrote P. From anterior it goes to the posterior. From the posterior it goes into this is azygos vein. The red one is azygos vein. From the azygos vein it goes into this superior vena cava, because there is a block at this aspect. So it can't come directly. So it took a route where internal thoracic vein, anterior intercostal vein, posterior intercostal vein, then comes the azygos vein. From the azygos vein it goes into superior vena cava. From the superior vena cava it goes into the right atrium. This is the second mechanism you have to understand if there is a block above the azygos vein. The first one I told you, internal thoracic vein, then the superior epigastric, inferior epigastric, external iliac, common iliac, inferior vena cava, then the right atrium. And second it is internal thoracic vein, anterior intercostal vein, posterior intercostal vein, then the azygos, then comes the superior vena cava and then the right atrium. So these are the things you have to understand if there is a block above the azygos vein. Let us see if there is a block below the azygos vein. So let me read first. The obstruction to superior vena cava below the opening of azygos vein. It goes into the brachiocephalic vein, subclavian vein, axillary vein, lateral thoracic vein, thoracoepigastric vein, superficial epigastric vein, femoral vein, iliac vein, common iliac vein, inferior vena cava, then the right atrium. Or it can go into the internal thoracic vein. So what is it trying to tell us? Let's see. Now the block is at this aspect, right? That is, the block is below the azygos vein. If the block is below the azygos vein, the atrium. So now let us understand how the blood goes into the right atrium. So let us go with the first thing. The blocked blood goes into the brachiocephalic vein. From the brachiocephalic vein it goes into the subclavian vein. From the subclavian vein it goes into the axillary vein. This is an axillary vein. This is a subclavian vein. This is an axillary vein which is a continuation. From the axillary vein it goes into the lateral thoracic vein. This is the lateral thoracic vein. From the lateral thoracic vein you can observe here it goes into this, what is this, thoracoepigastric vein. This is thoracoepigastric vein. From the thoracoepigastric vein it goes into the superficial epigastric vein. From the superficial epigastric vein it goes into the greater saphenous vein. From the greater saphenous vein it goes into the femoral vein, right? From the femoral vein you can see this, it goes into the external iliac. From the external iliac, common iliac, then the inferior vena cava, then the right atrium. So if there is a block below this azygos vein, it goes into the brachiocephalic, then comes the subclavian, axillary. Let's not by heart, because you know continuation of subclavian, axillary, so you know about the brachiocephalic. Then comes the lateral thoracic vein. You got a vein which is lateral, right, in the thoracic region, so it is lateral thoracic vein. From there it goes into thoracoepigastric vein. You got a vein which connects this thoracic and the epigastric. Thoracoepigastric vein. This is a thoracoepigastric vein. then this lateral thoracic vein, thoracoepigastric vein, then that go to superficial epigastric vein. You know that superficial epigastric artery, right, branch of external iliac artery, right, just but this is vein here, that goes to the greater Stephanus vein. Then the greater Stephanus vein, you know that it drains into femoral vein. You know that femoral vein then continues as external iliac, then common iliac, inferior vena cava, then at last goes into the right atrium. So ultimately, if there is a block below this azygos vein, we have drained the blood into the right atrium. So right now we are in the safe side, though there is a block. So these are the things you have to understand regarding the veins and the blockage of superior vena. It's time to understand now regarding the intercostal nerve. So let me read first. The intercostal nerve, it is the ventral ramus of thoracic spinal nerve. You got a branches here. The branches are, the first one, there is a one anterior cutaneous branch. Second branch is lateral cutaneous one, and third branch is muscular branch. T3 to T6 are typical intercostal nerves. So T1 joins the brachial plexus and supply the upper limb. And you have got intercostal brachial nerve. It is undivided lateral cutaneous branch. It joins with median cutaneous nerve of arm. The lower intercostal nerve supplies muscles of anterior abdomen wall more than T6. So what is it trying to tell? So let us understand the intercostal nerves. The first thing written in our notes is it is an ventral ramus of thoracic spinal nerve. You can understand this. This is a spinal cord. This is a dorsal root and this is ventral root. The dorsal root and the ventral root, they both fuse and they divide into ventral rami, which is anterior, and the dorsal rami. Intercostal nerves, they are from this ventral ramus. So it is an intercostal nerves. It is ventral ramus of thoracic spinal nerves. It has got a branches. If you see branch. So this is anterior cutaneous branch. And the second one you have got lateral cutaneous branch. The third one you can observe this branch. This is what the muscular branch. So you got three branches at this aspect. The first is the anterior cutaneous branch. Signal problem, let me adjust. Yes, you got an anterior cutaneous branch. You got a lateral cutaneous branch. And you have got one more, that is a muscular branch. This acts as a motor supply to the muscles, right? So this total you have got T12. Out of T12, right, T3 to T6, they are called typical intercostal nerves. So what I told now, this is a typical intercostal nerve. So let us understand what are atypical intercostal nerves. If you look at the T1, right, so this is T1. T1 joins with brachial plexus. You know that C5, C6, C7, C8, T1. So T1 joins with the brachial plexus. And you can see it supplies the upper limb. So you can see the orange one, this is where the T. So these are the things regarding this T1. And now it's time to understand the T2. So what is T2 here? T2, it is intercostal brachial nerve. It is undivided lateral cutaneous branch. It's with the medial cutaneous. You can see at this aspect. This T2 is known as intercostal brachial nerve, right? It is a lateral cutaneous nerve. This T2 is called as intercostal brachial nerve or the lateral cutaneous nerve. This lateral cutaneous nerve, which is T2, that along with this medial cutaneous nerve, right? So it joins with medial cutaneous nerve and it supply, you can see here, right? It is supplying at this aspect, right? It is supplying the nerve arm, right? So it joins with the medial cutaneous nerve, right, and supplies the arm. And the next thing you have to understand, we spoke about the T1, T2, T3, T4, T5, T6, and you have got the T7, T8, T9, T10, T11 and T12. They supply the anterior abdominal wall. You can see the nerve supply of these. They supply the anterior abdominal wall. So these are the basic concept you have to understand. Now it's time to understand the location of the lungs, a surface landmarks. You can see this. We are dividing the surface landmarks of the lung in three regions. One is a mid clavicular, another is mid axillar, next we have mid scapular. Let's say mid clavicle, that means we are taking midpoint of the clavicle. Let us see the location, the level of each. We are looking at the level of lungs and the pleura. If we look at the mid clavicular, the lung is present till the sixth rib, but the pleura is present. So these are the things you have to understand. This is sixth, then pleura is stopped till 8. If you look at the mid axillary line, right, the lung is present till 8th rib and pleura till 10th rib. That means if you see this, one minute. Yes. You can see the locations of the lung nerve. That means we understood in the mid clavicular, the lung is present till the 6th rib and the pleura is present till 8th rib. In the mid axillary, the lung is located till 8th rib and till the pleura is till 10th rib. If you look at this is mid scapula, this is scapula, where it is present 10 and 12. So how do you remember this? You can see this is 6 rib, 6 plus 2 is 8, 8 plus 2 is 10. So as you move from anterior to the backward, right, this becomes the level of 6 rib becomes the level of lungs. Mid axillary is 8 plus 2 is 10. So that is how you can remember. Also you can add it by 2. 8 plus 2 is 10, 10 plus 2 is 12. So that is how you can remember. Now let us finish the session by speaking about the apex of lung. It is written that the apex of lung projects 5 centimeters above the first rib, 2.5 centimeters above the clavicle. It is covered by cervical pleura, which is further covered by Simpson's fascia, suprapleural membrane, cervicothoracic diaphragm and scalenus minimus. So what is it trying to tell? You can see this is lung here, this is clavicle, right? If I measure the distance, right, apex of the lung projects 2.5 centimeters above clavicle. If you measure from the clavicle, the apex of lung is present till 2.5 centimeters. If you look from the first rib, this is an apex. You can see the apex of lung, right? So 5 centimeters above, right, 5 centimeters above first rib. So you have to understand from the clavicle 2.5 centimeters you have got apex, right? If you measure from the first rib, it is 5 centimeters above the first rib you have got apex of lung, right? Now let's see if this is the apex of lung, right? It is covered by a cervical pleura. This is cervical pleura, the black one you are seeing, the cervical pleura, and it is further covered by this suprapleural membrane or Simpson's fascia. You can look at this. This is a Simpson's fascia or suprapleural. Below this, the Simpson's fascia is also called as suprapleural membrane or the cervicothoracic diaphragm or scalenus minimus. So these are the basic concept you have to understand. You can see the attachment, it is attached to the C7. So these are the basic concept you have to understand regarding the apex of lung. In the next session we will be dealing about the other concepts. Thank you.